Good afternoon. We have with us Dr. Pramod Sood, Professor of Critical Care Medicine at the Anand Medical College in Ludhiana. We thank you so much for taking all the time and we welcome you to Natco Pharma Specialty Critic on 2024 Studio. Uh, with your experience, Doctor, we like to look forward to the advice the young generation can get from you in the space of critical care management and also which is associated with bacterial resistance. My first question is, how do you foresee the changes in critical care management?
Uh, Critical care previously was considered to be a branch where once a patient landed upon a ventilator, and that was considered as a dead end of the patient. But over the years, I think the critical care has progressed a lot, and it is no longer a myth or it is no longer a doom that if the patient lands upon a ventilator, he is a dead end. So we have many of our patients which comes up and appropriately treated with the proper sports, they do recover, and the mortality has significantly decreased over the last few years, 10 years down the line. So few mortality has decreased considerably, and a significant impact has been because of the awareness and because of the faculty itself developing across India as a separate entity of Department of Critical Care and Medicine, and that has led to changes in the critical care perceive and the people who at the normal level also they do understand the this to be a specialty, particularly when you are going into the bigger cities or even in the smaller cities, the specialization has come up in a significant way. So overall, I think the increased awareness that has led to a significant decrease in the mortality in terms of the ICU patients.
I think your statement makes a ray of hope to the patient, their families, especially as to what you just said. What is your advice to the young ICU doctors to enhance patient care?
For a young doctor, first and the foremost is uh, when you venture into a critical care, you should be well aware that it is 24/7 into 7 into 365 days job, and it is not a mere job. Once you are off, you are off. It is not like that. You may have a call at any point of time, because looking into the place and looking into the department in which you are, and I think it's one thing that needs round the clock, and you have to be available round the clock to at least you or someone else from your specialty should be available to give a good impact onto the services to be provided. So for a young guy who, and it is a passionate branch, a small decision of yours can make a significant difference in the outcome of the patients. And the end result, whosoever doctor is stating it, it is the ultimate aim is the patient should get better off whatever you do. So it is an extremely challenging branch, and I think every doctor should be in a position and should take it at least with a good stripe. And I think with the good results coming up, I think more and more people should be joining it as a faculty and as a Department of Critical Care Medicine.
You being a professor in the critical care medicine side, how do you see the young doctors emerging?
With the advent of a number of courses, when I joined way back in 2000, I initially did my diploma, and then I did my DNB Critical Care from Hinduja Hospital, Bombay. And at that point of time, we don't have too many takers for these branches. But in Hinduja, we have a good number of people with a backup, and we have to a waiting period for before you go about with it, right? But with the advent of number of courses like DM critical care and DNB critical care coming up, and more students have been opting for DNB critical care, DNB or DM critical care. And I think down the line, with the more number of seats increasing and more people inculcating, I think the scenario should definitely change.
Great, that's nice to know. What is the prevalence of carbapenems producing bacteria in your practice, and what is the best treatment options?
Carbapenems first, exactly when you look into your sensitivity pattern. Okay? You should be better able to understand whether it is a carbapenem resistant or it is a carbapenase producing organism, right? So if it is a pen resistant to all the carbapenem group of drug, so it is basically a carbapenase producing organism, right? And if in comparison to carbapenem resistant, carbapenem one or the other carbapenem might be sensitive. So if you have a patient who is a carbapenase resistant, the carbapenem is out, and so do the any of the beta lactam group of antibiotics. ठीक है? So it is important that and it depends upon the type of organisms, whether you are dealing with Enterobacteriaceae or you're dealing with something of a Pseudomonas. ठीक है? So if it is an Enterobacteriaceae, beta-lactam is inhibitor along with avibactam, or the other drugs should be properly used in these set of circumstances to go above it.
Dr. Pramod Sood, thank you so much for your valuable time and thank you for being with us in the studio. We wish you all the best.